Today we will discuss poisoning, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Poisoning, in layman's terms, refers to a situation where someone has ingested, inhaled, or come into contact with a harmful substance that can cause illness or injury. This can happen from things like certain foods, chemicals, plants, or medications. Signs of poisoning. If someone is poisoned, they might experience various symptoms, which can vary depending on the substance involved. Common signs include nausea or vomiting, stomach pain, difficulty breathing, dizziness or confusion, weakness or fatigue, skin rashes or burns. What to do? If you suspect poisoning, 1. Stay calm. Try to remain calm and assess the situation. 2. Identify the substance. If possible, find out what was ingested or contacted. 3. Call for help. Contact emergency services or a poison control center immediately. 4. Follow instructions. They may provide specific steps to take based on the substance involved. Prevention. To prevent poisoning, keep harmful substances out of reach, read labels carefully, and follow safety instructions. If someone has poisoning, here's what to do in simple steps. 1. Stay calm. Keep cool and don't panic. 2. Check symptoms. Look for signs like vomiting, trouble breathing, or confusion. 3. Call for help. Contact emergency services or a poison control center right away. 4. Identify the poison. If you can, find out what they took or came into contact with. 5. Don't give them anything. Avoid giving food, drink, or medicine unless instructed by a professional. 6. Stay with them. Keep an eye on the person until help arrives. Always act quickly and seek professional help. In the hospital, here's what doctors and nurses typically do to help someone with poisoning. 1. Assessment. They check the person's symptoms and vital signs, like heart rate and breathing. 2. Activated charcoal. If appropriate, they may give activated charcoal to help absorb the poison. 3. 4. Fluids. They may provide fluids through an IV to keep the person hydrated. 4. Medication. They might give specific medicines to counteract the poison or to manage symptoms. 5. Oxygen. If the person has breathing problems, they may give oxygen to help them breathe better. 6. Monitoring. They continuously monitor the person's condition to see how they respond to treatment. 7. Supportive care. They provide care and support, making the person comfortable until the poison is out of their system. The treatment depends on the type of poison and the severity of the situation. Here are some specific medications commonly used to treat different types of poisoning. 1. Activated charcoal, used to absorb certain poisons if given shortly after ingestion. 2. Naloxone, Narcan, for opioid overdoses. It reverses the effects of opioids. 3. Flumazenil, used for benzodiazepine overdoses, though it's less common due to potential complications. 4. Acetylcysteine, Mucomyst, for acetaminophen, Tylenol overdose. It helps protect the liver. 5. Atropine, used for certain types of poisoning, such as organophosphate insecticides. 6. Pralidoxim 2-PAM, often used with atropine for nerve agent poisonings. 7. Digoxin-specific antibody fragments for digoxin overdose, which can be life-threatening. These medications are administered based on the specific type of poisoning and the clinical situation. Always, the treatment is guided by healthcare professionals. Certain groups of people are at a higher risk of developing poisoning, including 1. Children. They are naturally curious and may accidentally swallow or touch harmful substances. 2. Elderly individuals. They might have memory issues or take multiple medications, leading to accidental overdoses. 3. People with mental health issues. They may be more prone to substance misuse or accidental poisoning. 4. Substance users. Those who use drugs or alcohol may accidentally take too much or mix substances. 5. Occupational exposure. Workers in certain jobs, like agriculture or construction, may come into contact with toxic chemicals. 6. People with pets. Pets may accidentally ingest harmful substances, putting both them and their owners at risk. 7. Individuals with chronic illnesses. They might take various medications, increasing the risk of interactions or overdoses. Awareness and prevention are key to reducing these risks. Now you need to watch my video on strokes or have a look at heart attacks.